Beaumont Urology is setting a new standard of care. We have highly skilled clinicians, nurses, and support staff providing outstanding care to our patients. We have over 45 urologists. Most are fellowship trained, and we cover every subspecialty of urology. So we can care for any patient from a simple problem to the most complex.
We take care of all the plumbing organs, right? So your kidneys, your bladders, sexual function as well, kidney stones, incontinence. Obviously there's kidney cancer, prostate cancer, bladder cancer, testicular cancer, difficulty urinating. The patient is the crux of all we do. And really we have to treat them and their whole family. And to me, that's what Beaumont Urology does.
Beaumont Urology has really become a destination medicine center. And patients come from all over the world to Beaumont. And one of the things they come to is the Women's Urology Center.
My bladder spasms constantly. It misfires. My bladder just goes all the time. It doesn't understand. It's not reading signals correctly.
The Women's Urology Center is a multidisciplinary center that is designed to treat chronic pelvic pain, voiding dysfunction, sexual dysfunction in women. But in the center are expert clinicians. There's expert urologists, gynecologists, we have pelvic floor physical therapists, integrative medicine, psychological services. Having all these experts working together in an integrated fashion provides the absolute best care we can provide to patients. Pelvic pain is something that we're really specialists in, and one of the treatments that we've developed is something called pudendal neuromodulation. This is like a pacemaker for pain to overcome the effects of chronic pelvic pain. And this is something that we put on courses every year to train physicians how to do. It's specialty centers like this that make Beaumont Urology one of the best urology departments in the country.
I think one of the things that's critical throughout Beaumont Urology, it kind of goes back to the foundation of compassion for patients. And that to me really is the Beaumont way.
When you have cancer, no one expects to get it, especially at 51 years old like myself. The biggest concern that I had was really how do I explain it to my wife. I didn't think I was going to have prostate cancer, so why get her all worried and excited? I
think there are lots of other institutions that treat people well, but I think we have that unique ability to merge technology, innovation, education, but yet we can do the hand-holding. You know, we can sit with somebody and cry with them or hold their hand, do all those things, get their families through it.
So I met with Dr. Kernan, and he walked me through all the different options, and then he and I set up a game plan for how do we share this news with my wife. It wasn't about here's my procedure and here's what you should go do. It was about explaining the situation, explaining and understanding so I could make the best decision for my lifestyle.
To be able to provide the best urologic care, we believe strongly that it's important to be involved in innovative research. And at Beaumont, we've done amazing research that has really led to changes in patient care globally.
We're always on the cutting edge of all this great different technology, whether it's medicine, surgery, stem cell research.
Beaumont was the first ever to use one's own stem cells to treat stress incontinence. Tibial nerve stimulation, it is placing a little acupuncture needle at the nerve in the ankle to treat overactive bladder symptoms. Those studies started at Beaumont. It is now an approved therapy and is used all over the country. Other areas of research we're involved in include minimally invasive treatment of prostate cancer, new treatments for overactive bladder, for erectile dysfunction, for chronic pelvic pain. We do a host of research here at Beaumont, and all the research we do, it really is with the patient in mind. And at the end, our goal is not to just do a study, but to provide a better care to the patients that we treat.
So when the Da Vinci robot first started, we were one of the early adopters of it. And now that is another huge area of we're doing great cutting edge technology for.
At Beaumont, the patient truly is the center of all that we do. We believe that they deserve to be treated with both compassion and respect. And at the end of the day, our goal is to improve the quality of life of the patients that we see.